Okay, we're going to take a second right quick and talk about the Hamilton ventilator. We're going to talk about specifically the pre-op checks and how to get this thing connected and up and running. You're going to have two different circuits. You're going to have an adult circuit that goes down to 5 kilograms, and you're going to have a pediatric circuit. So we're going to kind of talk about the adult circuit first. When you open up your packaging, you're going to have an expiratory valve that looks like this. This expiratory valve comes pre-assembled, but this little diaphragm will come off. So to slip it back on, you just kind of put it on there, line it up. It's got a index point that you just put it on that index point, make sure that it's completely sealed all the way around. And that's how you assemble it. Now, sometimes when you connect this thing into the ventilator and you twist it, this diaphragm will get off in a little bit and get twisted on there. So if you start failing your pre-op checks, you can take a look at that, and a lot of times you can take it out and it's the diaphragm. So you also have got a flow sensor, and this is the little flow sensor that comes with the adult circuit. The good thing about this flow sensor is once you get through with it, you stick it in your shoulder pocket and you've got an adapter for a lot of the stuff that we adapt, whether it be a CPAP mask or something of that nature. So anyway, when you get ready to do your pre-op check, you're going to connect this to this, and that's going to go onto here. Now, one of the major mistakes that people make when they first start doing this is going to tell you to turn the flow sensor. And what that means is it doesn't mean to turn this. It means to pull this entire grasp the blue part of it and twist it out from the circuit and flip it. And you're going to connect it back there. You're going to do the same thing again. You're going to flip it again. That's how you're going to do it. A lot of people will make a mistake of pulling it off and doing something all weird, but that is not the right way to do it. The way to do it is completely pull it out and flip it around. The pediatric is exactly the same. The exhaust valve is pink, and it's got the same diaphragm setup. When it comes down to the circuit, it's going to be a blue and white tubing, just like this, and the flow sensor for it is going to be this straw-looking thing. All right, so haven't really found a use for this in medicine after we get through with it, so usually I just toss this. So that's going to be your 5 kilos and below. There's going to be a pink one with a blue and white tubing on there. So we're going to say that you just powered up your ventilator and you're going to do a pre-op check. So one of the first things that you want to notice is whenever you go to do pre-op check, you want to make sure that if you're doing a flow test on a adult circuit, you want to make sure that this adult peds is selected. Otherwise, if you select neonate, it's going to sense that you've got the wrong flow sensor. So we've got adult selected, and we're going to go down here and go to pre-op check. Now your ventilator, our ventilator that we normally use, has a different user interface. This is a spare, but it's all I've got right now to do it. But it's pretty similar. You just go to adult and you go to pre-op check. You're going to see 3 different checks that we're going to do here. We got a leak test, a flow sensor, and an O2 sensor. The most important one right now that I want you to really get focused on, learn how to use, is the flow sensor. So we're going to insert the exhaust valve into the exhaust port here. And the way you're going to do that is got this goes to the bottom. So you see this little kick out right here. It's going to go straight in, aiming toward the bottom with that. It's got a cutout. It won't go any other way. You're going to go in, push, and do a clockwise quarter turn, and you'll feel a positive lock in. You're going to connect up your circuit. So this circuit, I've seen people turn it backwards, but you want to make sure that this is going toward the front of the ventilator. So your circuit should be pointing toward the front of the ventilator. You're going to put it on the bottom one, and you're going to kind of twist it and put it on the top one, kind of get it snug there. At that point, you're going to take your tubing, and it's pretty simple. You're going to go blue to blue, white to white. So this is not exactly white, it's off white, but you're going to take your clear and put it on the white, and you're going to take your blue and put it on the blue. So a lot of times when people have a failed flow test, is because either A, that diaphragm has gotten crooked on there, or they don't have these plugged up, or they have come loose. So I'm going to flip it back around. So now we're going to do the pre-op check. So the way that you're going to do this, you're going to start off in this position. You're going to have the flow sensor pointing out like that, and these tubings are going to go down. So we're going to connect it up just like this. We're going to go to pre-op check. We're going to go to flow sensor, and we're going to start the test. It says disconnect patient. We don't have it connected. It says flip flow sensor. You're going to take it out right here, flip it over there. You're going to hear this thing start to ramp up, and when you start hearing it ramp up, and it continues to escalate, that's a good sign. That means that as long as you pay attention to what you're doing, it's going to take just a second, it's going to pass. It says turn the flow sensor. We're going to take the entire thing off and flip it again. It's going to go through the same process of a ramp up, and it's testing the flow through that sensor. Green is good. We check that box, so that means that we have done our proper check. Now we're going to move on to the leak test. So if you have to do a leak test, this is how you would do it. You would take this off, put it in your pocket, save it for later. We'll go to leak test. This is very simple. Same circuit, leaving it connected. It says disconnect from the patient. It's disconnected. Now it wants you to block it. So you're going to take your hand, seal it off just like that, and it's going to go through a series of tests. Just follow the directions and you'll be just fine. All right, it says reconnect. So you just unocclude it, and it passed. Now, every now and then you'll have to do an O2 cell sensor check. So for some reason this will happen. Somebody probably could tell me why, I don't really know. But you simply disconnect it from the patient, and you hit O2 sensor, and it's going to say to turn the O2 down below 99% or disconnect the O2 supply. That's what I normally do. I seem to have less problems. Now I'm going to spare you the time it takes for this to actually do, but a lot of times it'll go up and it'll go up to 100%. It takes a couple minutes and it will pass. If it doesn't pass, you've got a O2 sensor that needs calibration. You'll have to actually bring it in and go to the shop with it. All right, now we are going to get a pediatric, and we know that the kid weighs 2 kilos and we're going to have to change circuits. So we unpackage our new circuit. It's going to come with a new exhaust valve, which is pink. So we're going to come over here and we're going to disconnect this one. So a counterclockwise turn and pull it out, set to the side, and you're going to put in this pink one. Automatically it knows that the last test, it was done on a pediatric circuit. So we're going to know that it's going to alarm. So in order to get ready to do this, we're going to connect our ventilator up. You're going to go blue to blue up here, point it toward the front, and then your clear one's going to go here. And the same thing applies on your tubing. So you're going to go clear up here on the white, and your blue is right here, like that. All right, now we're going to have to change out our flow sensor, which we did. We're going to go neonate, we're going to go to pre-op check, and we're going to go to flow sensor. All right, I've already got our piece connected here on the ventilator tubing. So we go to flow sensor, connect or select it, and it's going to tell you disconnect patient. There's no patient connected, and now it's saying flip flow sensor. Take the whole thing off, flip the whole thing around, and that goes in there. Same thing applies. It's going to ramp up. It tells you to turn the flow sensor again. You'll just flip it around. It's going to go through the same process. And I already know it's going to pass because it went through that ramp up stage. All right, we get the green check mark. So with that being said, this flow sensor or this circuit is ready to go on this pediatric exhaust valve. A lot of times what happens is somebody has flown a small child in the middle of the night, you come in on your shift and you don't realize that it's still set up for a pediatric, because most of our patients are adults. You'll get to the bedside and lo and behold, you'll realize it has not been done. So be nice to your crew members. If you don't do a check or a conversion back to the adult circuit, let them know so they don't get to the bedside and have to do it at the bedside. So that's how you do the pre-op checks. They're pretty simple. As long as you follow the directions, they are going to pass unless there's something wrong. Every once in a while, if you do get a failure, I've seen this a few times, and you've done everything right, if you reach inside of this housing here, sometimes you run your finger around, I've found a crack in that blue housing. And if it's loose or it wiggles at all, there's a problem with it. Somebody's dropped the ventilator or something has happened to it, and that is out of service at that point. You need to swap it out. But that is after multiple failures. Make sure you check that, just kind of feel and make sure it's not loose. So the last thing I want to talk about right quick is how to power this ventilator off. So to power it off, it says it right here below here. A lot of times you'll have alarms going crazy in the trauma room. It says to power off, press and hold the standby key for 3 seconds. So hitting it is not going to do anything except put you into a standby mode. But in order to power it off, you're going to have to press it, put it in standby, and then it says press and hold for 3 seconds. You're going to press 1, 2, 3, and it's going to power off. So a lot of times you're fumbling with it, trying to get it to shut up. People are looking at you, so just know how to power it off. That's going to be something that's super important when you're first starting out.